各位观众，大家好，欢迎收看港湾 TV。今天是12月31号，星期四。今天的日子比较特殊，2020年的最后一天，我们也希望把所有的不好的、糟心的、那个坏的运气都留在了2020年，丢进了2020年。那我们迎接更美好的2021年。所以我陆陆续续收到的邮件啊、朋友啊、客户啊、partner 啊这些邮件啊，都是一个 brighter 更光明的我们一般都是祝福明年就是快乐 happy wish you a happy new year， 或者就是很简单，往年都这样 wish you a happy new year， 或者是 prosperous happy new year。那今年多了一个 brighter 因为我们现在这个2020年经历了太多的经历过了太多的那种不好的、黑暗的，就像英文里边说的，疫苗要来了，我们现在已经看到了曙光，我们在隧道的尽头看到了隧道的尽头的光。现在还没有完全到，但是我们已经看到了这个光，所以我们已经经历了we have gone through the darkest period of the time in our life maybe 在我们的生命当中最黑暗的一段时光我们可能经历过了。那么2021年会有一个新的开始，新的好运，也祝所有的屏幕前的观众朋友们大家新年快乐。那么 Bonnie Henry 呢也说这个疫苗要来了，希望大家再坚持 weeks。 英文里边呢和中文呢有一些相似他们中文呢，我们古代学古汉语的时候说6、3、9都是虚数，那么英文里边它就是用 weeks or months 加一个 s， 就是可能是几周，可能是几个月我们只有到了疫苗来了，只能才能够真正的摆脱这个新冠疫情对我们人类的冲击和影响。从这个计划来讲，到12月31号今天为止，我们 BC 省应该到的这个疫苗的剂量是3.5万剂量。那也就是说目前为止，从上个礼拜到前个礼拜包括过去的一个周末5天，一共打了1.5万支剂量。那么这是前几天的数字，这2天不知道，因为前天我们做新闻简报的时候 Bonnie Henry 说过，目前为止辉瑞制药的疫苗全部供应给低陆平原，因为这个里边有牵涉到包装和运输的难题。Moderna 因为它的储存要求很低，我说的很低是相对的，也就零下20度，一般家用的冰箱的这个冰冻的部分大家调到6档，就是相当于零下20度，所以都能储藏，这是一个问题。第二个问题呢，包装更加灵活一点，它这个一盘一盘出来才100多支，100支，而且可以分散了。那么辉瑞呢不行，你一盘拿出来190多支，拿出来就要打掉了。来了，他们毫无征兆的已经来了。
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. My rate is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Thursday, December 31st, the last briefing of 2020, and I believe the 160th briefing. We're honored to be on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh people. Honored to give this briefing on their lands. I wanted to say that there won't be a briefing or an update tomorrow. January 1st. We will be back in Victoria on January the 4th, which is Monday, and on that day we'll also be providing detailed briefing presentation around the vaccination plans and so on, which are evolving. So with that, it's my honor to introduce Dr. Bonnie Henry.
今天的角度好像有点不一样有点像这个
Thank you very much and good afternoon.
私生子的这个角度啊。
Today, we report 683 new cases here in British Columbia, including 2 epidemiologically linked cases, bringing our total number of cases of COVID-19 to 51,983. That includes 105 people in the Vancouver Coastal Health Region, 447 people in the Fraser Health Region, 11 people in Vancouver Island, 64 people in the Interior Health Region, 36 people in the Northern Health Region. I will say that there has been some over-reporting due to a data system change from Northern Health, and those numbers will be reconciled over the next few days on the dashboard on the BC CDC website. But the numbers for today are 36 new cases. That gives us 7,803 active cases now in British Columbia. Of whom 374 are in hospital, 76 people in critical care or ICU. We have a little over 9,364 people under active public health monitoring. And again, due to the data system change in Northern Health, we're still catching up with those numbers. We also have 42,129 people who have recovered from COVID-19. In the last day, we have had 8 new deaths from COVID-19 across British Columbia in the Fraser Health and the Northern Health Region, bringing the total number of people who have died in 2020 from COVID-19 to 901.
好，901个，他说了啊，2020年总共就是901个啊，巴黎死亡。那么也是说了一些客套的不是客套，说错了，就是常规的话。
Who mourn with you.
我们都一起跟你们悼念啊，他也是这个意思，这个意思。
We have 3 new healthcare facility outbreaks at the Williams Lake Seniors Village, the Ridge Meadow Hospital in Fraser Health, and Langley Memorial Hospital Long-Term Care, also in Fraser Health. And 2 outbreaks have been declared over at the Sandwich Peninsula Hospital in Vancouver Island and the Banfield Pavilion outbreak in Vancouver Coastal Health. Leaving us with 52 active outbreaks in long-term care and 9 in acute care, and involving 1,412 residents and 733 staff. In addition, the Bighorn Hotel community outbreak has also been declared over.
那么还包括一些具体的，说哪一个已经宣布疫情结束，官方宣布疫情结束。
On a positive note for our vaccine update today, to date, as of yesterday, we had provided immunizations for COVID-19 to 17,510 people across BC in every health authority and every health region. And they have all received both the Pfizer vaccine and, as of the last 2 days, we've also had Moderna vaccine, the second vaccine which has been approved for use in Canada. And that has been increased our ability to expand immunizations even further. And on a very positive note, we've had the first immunizations in some of our more at-risk remote and rural communities, including some of our First Nations communities across British Columbia, and it's a very happy moment for all of us to be able to protect the elders and seniors in these communities. As has been the case since the start of this pandemic, the fewer faces and bigger spaces that we are in, the better. That means less risk for all of us. And right now, we have been trending in the right direction for the last few weeks, although the increase today reminds us that we are still in a very precarious situation. And we can only look around us, whether it's other jurisdictions here in Canada, around the world, our partners to the south, where we see this virus continues to wreak havoc and to cause illness and death. As the new year brings a fresh start for all of us, we must start 2021 in the right space on the right foot. And the only way we can get there is for all of us to continue to stay small and stay local, particularly for our New Year's Eve celebrations tonight. Yesterday, we amended an order to ensure that places like restaurants and bars and liquor stores stop serving or selling alcohol at 8 p.m. The rationale behind this step is simple. Alcohol, as we know and as we have seen far too many times this year, limits our inhibitions. What can begin as a quiet dinner with our household or a drink with a friend can too easily get out of control. And sadly, we have seen that happen even in the past few weeks. When that happens, rules can be forgotten, and servers and restaurant staff are the ones who must enforce these rules for the safety of everyone, including the staff. I have heard, unfortunately, about holiday celebrations being planned, some for several hundreds of people. And I've heard from many who work in BC's restaurants and bars who are worried about their ability to manage those situations, particularly on a night like tonight when there was a build-up for a number of these occasions. I recognize absolutely that these restrictions are yet another challenge the restaurant and the food service industry has had to face in what has already been a very tough year. But 2 hours now is necessary for us to manage a situation that is going to be lasting for many more weeks. We have worked very hard to make sure that restaurants are able to operate safely, and they have done that over the last few months when in jurisdictions all around us they have been closed down for in-service. We know that they can operate safely and that we can use and benefit from them. But right now, we need to hold the line, and that's to make 2021 a brighter year for all of us, so that we can get back to full business for everyone as soon as possible. I am confident the small step that we took will help us start the new year on a healthier and safer note. I also think it's important to look back on the year and realize what we have accomplished by working together, that we can all still celebrate in a smaller way tonight. I know that some people's plans have changed for this evening. One of my team members, for example, cancelled her 9:15 reservation for dinner at her favorite local restaurant, but she and her partner are now going there on Sunday instead, and spending tonight at home. And I would encourage all of us to think about that. It's not just about tonight. It's about supporting our local businesses, our local restaurants, our local pubs over the coming weeks as well. As we've done a lot to keep our restaurants open safely, it needs to be more than just tonight. Many of us will be ordering our favorite meals in, myself included. Others will be having games nights in with their households or celebrating with friends from around the world through a virtual party. Whatever your plans may be this evening, please remember how important it is to follow the public health orders and restrictions. The actions of a small group of people, as we have seen before, can have consequences, not only for them in the form of potential fines, but also, as we have seen with people ignoring orders, but also for the majority of people who are doing the right thing every day to keep their neighbors, their families, their communities safe. By staying local, keeping our circles small, and following provincial health orders, I know we will start this new year on the right foot. 2020 has been hard on us. It has been hard on all of us. And this is no consolation for those many who have lost loved ones to COVID-19, to the overdose crisis, for those who have felt lonely in isolation, or lost employment or treasured business. At the same time, COVID-19 has shown us in BC that we can make a difference and bend that curve when we work together with a common goal. My hope is that by this time next year, we can look back at the sacrifices we made
明年的某一天往回走，往回看我们现在做的能够看到我们是这么走过来的那么希望大家还是要能够相互连结，就算是用这个虚拟的方式联系，不要这个孤立。
This includes how you choose to spend
那么
your
这个
New
也
Year's
是我们现在所行为所产生的行为都会对将来产生的结果产生影响希望我们每一个人都能够正确的面对这个新冠。
But it will not define us. As we came together in adversity in BC, in the face of this global crisis, what will define us is how we did that in kindness,
所以希望我们能够有热情，相互容让，相互客气那个正确的面对这个病毒。我也希望每一个人一个明年有一个快乐的、安全的新年，2021年希望大家更快乐、更光明。我们也继续，我们也能够已经做到了更加团结。我们还是他三个 ：be kind, be calm, be safe 谢谢大家。今天的伯尼医生这一段话写得相当好，我边听边给大家说，可能一下子还记不住，但是他的这些话呢，我估计也不会有书面的给大家。那么卫生局长也是按照惯例，代表省长，代表他本人，代表伯尼医生，对这个过去24小时死个8个人的家属表示诚挚的哀悼。那么过去24小时呢，新增了683例，总数到了51983例，那么新增的呢，那个沿岸卫生局我没有记下来，但我可以计算一下683减掉447，447是飞沙的，11是岛上的，64是北部的，36是64是内陆，36是北部125好，沿岸是新增125，那么住院呢是374，其中我们也稍微缓一下自我安慰一下。那么76个在重症监护。那么他是说了76个在重症监护，他说到了，因为他每次都要说一下哪些分布那么北部内陆以及那么也是感谢很多医护人员，从全球流行病开始我们医护工作人员这个付出的额外的艰辛的工作，额外的努力辛苦，也是感谢他们。那么也是感谢所有参与的人提供给我们那么多这个及时的信息。
An important and popular service in our healthcare system,
那么还有一些公共服务系统的人
，145,117 calls last year.
每年要有多少？今年有多少的 call 量？太多了，比910,000的90多万个 call 量是比往年多了1倍多，还不止。那去年是40多万，今年是90多万那么他还很多的电话要应答等等。谢谢。谢卢卢西我们大家都 Happy New Year 谢谢你
everyone who's been involved in that, and I think that people who seek help from 811
也祝你这个广大网友新年快乐2021年有一个更加光明的
Also want to note that we've added new people working as contact tracers in the province this week, another 22. That's 1,297 people have been hired since the program was announced by the Premier at the end of August. Our original target was 500. Our final target was 1,224, and more than 100% of that target is complete. In addition to that, we approved the First Nations Health Authority to hire 76 community health representative positions to support culturally safe contact tracing. And that as of Friday, December 18th, 1.5 million of the 2.5 million on that initiative has been spent and or allocated to regions and is in the hands of communities. All new hires will go through a training program that is centrally coordinated by the First Nations Health Authority and will include modules on public health, privacy, confidentiality, trauma-informed care, harm reduction, and infection prevention and control. We continue to look at building our public health teams in this time in what's going to be an extraordinarily busy year. We have 362 further candidates in the interview stage and 123 candidates in the offer stage. I wanted to note that in our acute care hospitals at present, of our base beds overall in the hospital system, we're at 84.8% capacity, very similar to yesterday. That means vacant beds in our base complement of beds are 1,424. That are those are the available vacant beds. That our overall capacity, when you add surge beds to that, we're at 66.7% occupied right now, which leaves 3,977 vacant beds or beds that could be used in the coming weeks and months should that be required. In critical care, the capacity is currently 74.7%, and that leaves 132 base critical care beds that are available that are effectively vacant at the moment. And when you add our surge beds, that number goes up to 376, as we are at 51% occupancy. So what that continues to mean is that while we have a significant number of people obviously with COVID-19 in our hospitals today, that number is 374, that we have capacity, and this is to a degree the difference between British Columbia on the acute care side and other jurisdictions. We continue to have substantial capacity to do that. That said, people in acute care, everyone working in acute care is dealing with an extraordinary situation, and have done so, I think, in a way that we can all be very proud of, that represents, I think, something that all British Columbians can be proud of. Next week, along with Michael Marchbank, who's heading our surgical renewal commitment across British Columbia, we'll be reporting in detail on the last number of months and on where we are in detail with the surgical renewal commitment that we made, that the Premier made on behalf of the government in May, and I know you'll be looking forward to that briefing, which reflects, well, all of this is going on, the remarkable work done by everybody in the healthcare system in this time. In closing, we're preparing, of course, to close out a year, and it's been a year of great loss for many people. For many people, that loss has been more than others. They've lost members of their families. 901 people have passed away from COVID-19. It has been都是属于新冠有关的死亡是2020年，现在他们有一个画了一个句号了，就901个啊，这个也是昨天为止新增了8例死亡。 And we know, we all, I think, especially those people, but all of us, in the year changed for all that has been lost. But we've also ended the year with, I think, significant resilience. We've shown that our actions matter, and with knowledge that our kindness, our generosity, our selflessness, and our strength make a difference. In the end, 2020 was a year where we showed a willingness, an unending commitment to achieve one purpose, to save lives. That when we stand apart, we save lives. That when we wear masks, we save lives. That when we stay home and we're sick, we save lives. And that we shop local under COVID-19 safety protocols. When we dine local, and stay local, we save lives and support our community. We save lives when we stop for a moment to think on that. And a year-end gives us license to do that. We see the awesome power that we have, every single one of us has, in our BC pandemic, and the care we've taken with it. To me, of all the things that bode well for the year ahead, for a better 2021 for everybody, the vaccines, our innovation, our adaptation, our spirit, it is the dedication, the consistency, and our persistence under adversity to save lives that offers the greatest hope for all that is possible. I thank every British Columbian for all that you've done, all that you've sacrificed in 2020 to save lives. I wish everyone a better 2021. Aujourd'hui, nous annonçons 683 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 52 015 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 8 nouveaux décès liés au COVID-19 pour un total de 901 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 374 personnes sont actuellement hospitalisées, dont 76 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. And a reminder to the media to please press *1 to line up for questions. We will be taking one question and one follow-up this afternoon. Also, please do not mute your phones. You will not be heard until I call your name. We begin today with Keith Baldry, Global News. Keith, go ahead, please.
Hi, thank you very much. Happy New Year to both you and Mr. Dick. I'd like to ask you about the restaurant industry's reaction to the change in the closing time. So basically, one of the chief criticisms from that sector is that they weren't given enough time. This was very sort of last minute from their perspective, and some of it had made expenditures based on an anticipated revenue stream that may not be there now. Just wondering what the reason was not to announce this earlier.
Yeah, we've been obviously signaling for some time about the issues around New Year's Eve and around the holiday season. So I don't think this came out of the blue in that respect. And we were looking for ways to do it that address the issue that we have been seeing continuously. And the issue really is that later in the evening, when people are drinking a fair amount, we tend to see groups getting together and it being very difficult to maintain the COVID safety plans in those situations. And we've also seen people being outside and accessing liquor from some of the private liquor stores, etc. So that was the issue that we were trying to address. And we did that by reducing the hours that alcohol is available tonight. So it doesn't affect the times that restaurants are able to serve food and they're able to stay open. It's just around the timing of being able to serve alcohol. And we did obviously consult with a number of people in the industry, and we recognize that many people had several servings and that restaurants have been doing a really good job at their safety plans. And I encourage people to think about if you're changing your plans for tonight, for being flexible, support your local restaurants. You can go there safely with your household, with your close friends, and do that in the next coming days and weeks. It's not just about tonight and about 2 hours of not having alcohol tonight. It's about how we are able to manage this evening, but also going into the future.
Do you have a follow-up, Kate?
Yes, just curious why 8 p.m. was chosen. I know before 10 p.m. was chosen. Now it's 8 p.m. Was there science or data or some sort of studies that show or evidence that we've accumulated that suggests 8 instead of 9 or 7?
No, it was based on practicalities in many ways and based on what we were seeing and hearing were the times that people were having seatings. So that gives most second seatings at restaurants are about 7:30. So that gave people the opportunity to order a bottle of wine or whatever you wanted to have with your meal. So it was trying to find a level playing field for where alcohol was being served and making sure that we weren't having people from bars and from other events all going out onto the street or leaving venues later in the evening around the time that they would wait for New Year's Eve here closer to 12 o'clock. So we did want to move that up so that we, in discussions with municipalities and others, that became a critical time that we saw during other long weekends and celebrations when people all ended up on the street later in the evening. So if it's any consolation, it will be New Year's Eve in the Maritimes, and some people will be celebrating in this country at 8 o'clock anyway.
Thank you. The next question comes from Camille Bates, CP.
希望大家其实也就你开心的同时要安全，注意安全。
What your plan is, Dr. Henry, for the resumption of NHL games in Vancouver and when that could happen?
那么这个是问的是冰球的这个恢复的情况啊。
Planning, as you know, was being consulted on the return to play and return to practice plans from the NHL, and along with my colleagues across the country, the 5 provinces that have NHL teams, we sent letters, as you're probably aware. My colleagues colleague Dr. Hinshaw from Alberta was writing on our behalf. So we have made suggestions to the NHL, which they have taken up, and we believe that those plans meet the safety protocols in terms of a public health risk, and that they are going to be managed if they're adhere to those safety plans, that those are safe from a public health perspective. So it's now over to the respective provinces to determine whether the NHL games will happen or not.
那么现在就是可能北美冰球联盟的问题了，因为现在就是本省就觉得它差不多了，卫生条例都差不多了。那么这位女记者又问的是原住民的问题了啊。
How many of that and the Pfizer BioNTech vaccine are expected to arrive in BC more widely in the coming week or so?
Yeah, I don't have the exact number of Moderna that's gone into arms between yesterday and today. It's in the vicinity of several hundred doses, and we've had about 1,100 doses of Moderna arrive, and I don't have the number right in front of me, but it's
但是具体的今天和昨天，因为伯尼医生说过了，给原住民、给北部地区的全是用莫德纳的疫苗。
We know the clinics have started and have run through yesterday and today.
那么昨天开始诊所开始施打莫德纳的疫苗。
And there will be clinics again tomorrow as well.
明天也有打。
The next question comes from Cam Mitchell, CTV.
Hi, I'm wanting some clarification on why bars and restaurants was given less than 27 hours to figure this out when they've been planning for New Year's over, say, the last month. A lot of places went out of their way to stock up on different foods and, beers and wines and such, and they're now kind of out on that, and it was kind of pushing them right up against the clock when they were planning to go to 10 rather than 8.
So this is only about serving and selling of alcohol. The food, the dinners are all fine up until 10 o'clock, and you tell me that there's a huge difference in that 2-hour window in terms of selling alcohol. So what we are trying to do is level the playing field. We know that this has been a challenging time period, and we have heard from people in the industry that they were facing challenges with people planning to get together around the time of closing, and that it was later in the evening. So that's why we made the decision. I think we need to focus on what is still there. You can still obviously do takeout, you can still do some great meals in restaurants and local restaurants and pubs around the province.
都有时间的就是8点钟以后不许卖酒了。 然后10点钟要关门。我再给大家澄清一下，是我刚才说是8点钟关门，它其实只是说不能卖酒了。那么这个 BC Liquor Store 8点钟肯定关门了。
Present a doctor's note to be exempt from wearing a mask in public. We're just seeing a lot of people that sound like they're quote unquote being discriminated against when they have a physical or psychological or mental health disorder, and they're going into places they are told they can go because there is an exemption for not wearing a mask.
那个戴口罩的问题，有些人呢是心理的，有些人是精神上、心理上，有些人是残疾的，他们没有戴口罩，他们这些特例这个请他解释一下为什么他们可以不戴你们那个是怎么考虑的？
We've said this from the very beginning.
他说我们一开始
that
就
there
说
are
了，
some
给大
people
家
who
解释了。
cannot wear a mask for a variety of reasons. Either they're too young, they have difficulty putting it on or taking it off. We do not want to put a mask on anybody who can't remove it on their own if they need to. And there are some people, small numbers of people with valid medical, psychological, mental health reasons why they cannot wear a mask. What we are saying is that people need to be accommodated. This does not mean that if I don't want to wear a mask, I can go and shop or go to receive services anytime I want. This means you have to, we as a business need to accommodate, and people need to understand that they cannot put others at risk. So there needs to be concessions made for people, whether that means shopping online, having somebody get what you need from the store and provide it to you curbside, or have you come back to have the service at a time when there isn't other people around where barriers can be put in place place, and other measures can be taken. So this needs to be an accommodation on both people's sides.
Thank you. The next question comes from Alana Shepard, Glacier Media.
Hi there. My question is for Health Minister Deck. Thank you for taking my call, first of all. But I wanted to ask you about an interview that Premier Horgan had with News 1130 right before Christmas. He said he discussed his plan to spend Christmas with his son and his son's partner with you, and that you had told him his plan was okay. I just wanted to know exactly when this conversation took place, and just if you could tell me a little bit more about it.
Well, I think I've answered this question before, but I'm happy to do that again. I think a discussion with Premier Horgan, I don't have dates and times of discussion. Premier Horgan asked my advice on his circumstance. I don't think I didn't give him the best advice, and I take responsibility for that. But ultimately, he got it right and had dinner on Christmas Day with his wife Ali, and that's kind of the end of that story. What did I do on Christmas Day? Well, I had dinner with my wife Renee Sackler, and we had a very nice time. It was unusual. Like lots of people didn't see my mom on Christmas Day, and she didn't see her mom on Christmas Day, but we got through that, and that's what we did, and that's what we'll be doing tonight together, and that's what we'll continue to do. So my encouragament to everybody is stay with your household tonight, especially. It's really important right now. We talked a little bit about the provincial health orders, and Dr. Henry talked about those provincial health orders a little earlier about the orders around last call for alcohol. But I think what's important to recognize this week is 85 people, now 94 people, have passed away from COVID-19 since Christmas Eve, that we have a significant number of cases, that we have 374 people in hospital, and we really need people to dig in right now as we prepare our immunization campaign with now more than 17,000 people immunized. But as we do that we really need everybody to dig in, and to follow the guidance of Dr. Henry on important questions like washing your hands, and important questions like staying apart, and on following provincial health orders. It's my expectation that everyone will do that. Absolutely, everyone will do that, because it's important to do it right now, to dig in, to reduce the number of cases, and in particular, reduce
这样的话就会大量的减少我们减缓我们现在紧张的局势。我也是吃惊了，我是因为礼拜二给大家做直播，512、447、402、402，突然之间今天又683了。这个是不是因为圣诞节到现在1个礼拜开始显现了？这个有待观察了。因为下星期一给大家做简报的话，它又是分成4个阶段来做了。我估计这个数字要上去了。这个圣诞节正好到现在是快1个礼拜了。所以希望大家还是待在家里，待在本地。
Do you have a follow-up, Alana?
Keep small， 就是大家人数少一点，就是这个意思。
This question comes from Mary Brooks, Island Social Trends.
Hi, thanks for taking my question. Dr. Henry, would it be fair to say that your BC policy is now that one dose of the mRNA-type vaccine will be given when all the supply arrives, that you're not holding back any of the second dose at this time?
No, that's not entirely correct, and I think we talked about this a bit last week. What we have said is the first arrivals of the doses that we received in December and into January are going to be to immunize as many people as possible with their first dose, and because of when supplies are coming, it will be, this is still a 2-dose program, but we will be extending the period of time where somebody receives their second dose, and that's about 35 days rather than the manufacturer recommended 28 days.
因为这个药厂的建议是28天，因为我们省的这个货源的情况，所以是暂时是定了35天。
Just wondering how many of those people have been hired for training to work in long-term care.
那么这个是问卫生厅长的，你们有雇佣了额外的多少人来这个
the first element, which is
应付于
supporting
这个长期护理院
infection
的额
control
外的工作
and enabling visits in long-term care. More than 1,000 people have been hired. More than
$130 million
has gone out in support of that, and so those efforts
服务于
continue. I
全省
believe
各个长期护理院。
it's approximately 8,000 people have been cleared through the process now, so it's going well. We're on track, and I think on Monday I'll be providing a detailed response on the specific numbers, but all three elements of it are going, I think, quite well. It's obviously a challenging time for everybody in long-term care, but our commitment is for 7,000. That's to address some of the issues around COVID-19, to continue to raise staffing levels, and of course over time to replace people in long-term care as well. 7,000 is a significant commitment, and we're on the road to doing it. The programs are in place, the training's in place, and it has a number of elements, including providing money in the first stages for hiring in long-term care. That's one element of it, but it also involves significant training as well. It's a significant opportunity to encourage people in BC to find out information, to get involved through our website, because this is a sector where we need more workers. We're going to need more workers, and we have a pretty ambitious plan. That also means there's very significant opportunities for people to do something really important, which is to do this work, which is some of the most important work anyone can do in BC today and every day.
Thank you. The next question comes from Richard Zussman, Global. Richard, go ahead, please.
Richard,
Dr. Henry, just following up on the question Camille asked. At the end, you said it's still up to the province to decide whether the Canucks will be able to play home games in Vancouver. So what's the timeline for that decision? And am I right to interpret, based on your answer, that decision hasn't been made yet?
What we thought, Richard, would be very useful in dealing with the NHL would be to have our health officers, provincial health officers from across the country deal with them. I don't want to call it collective bargaining, but to discuss with them together, to speak with one voice. And that voice through letter was Dr. Hinshaw in Alberta, but it reflected the work of our health officers across the country. They asked for things of the NHL. The NHL, what the NHL has proposed has been largely deemed acceptable by them. We haven't given the final answer, but it will be soon. But if you know the way that we've approached this, I think in BC, the weight of what's been discussed and the effort that's been made led on our side by Dr. Henry and our provincial health team, but by the provincial health officers across the country, I think their recommendation, I would expect, and it's not my announcement to make, but I would say that those recommendations, which were unanimous from across the country, will be accepted here in British Columbia. So it'll be soon. It'll be in the next few days.
所有的省的只有推了一个代表跟这个 BC NHL 他们去有一个声音去跟他们谈，所以我们 BC 省都会尊重任何的他们的谈判的结果。
If there's any community spread, will there be any modifications done at school considering the variant? In the UK, they are extending their Christmas break. I know it's probably too late for that here in BC, but will there be consideration given to a pause on in-school learning
as you mentioned, the situation in the UK has been extremely stressful, and they're under a very intense lockdown as it is right now. So a very challenging situation there. We thankfully are not in that position, and we are watching very carefully for this variant here, but we have not yet seen a lot of spread in particular. So in terms of schools, I mentioned a few weeks ago in November, we pulled together a school task force to learn from what we have been through in the last few weeks and to pull things together and to reestablish that relationship and the communications and the tools that we need to restart safely in the new year. And there are a number that was led by the Deputy Minister Minister of Education, Scott MacDonald, and Dr. Rachel Gustafson. And so we have engaged in that process, and people are preparing to make sure that we can go back to school safely next week. And that is kind of exciting for lots of children.
Thank you, Dr. Henry. The next question comes from Craig Takuchi, Georgia Strait.
Oh, hi, Dr. Henry. Thanks for taking my question. I just want to check if there is a surge in cases after the holidays, what conditions or elements would prompt you to consider further restrictions or extensions? And do you have a difference in priority?
那么这位记者问的就是你有没有这个依据来做第三次的更加严格的严禁令？他说我们现在还没有这个，我们现在在密切观察全省以及全球的疫情分布疫情发展情况。那么我们现在因为完全都不一样的，我们是看到了疫情，大家都看到了往在下。
many small groups of people coming together leads to lots of transmission, unfortunately. And we're starting to see that. So it will depend on what we're seeing over the next little while. But we have leveled off at a number of cases that is still very concerning. We know that this virus can take off quickly. So we will be looking at where are the situations that we're seeing transmission, what is the impact of what has happened last weekend and of course tonight and going into this weekend. So those are critical things. This is why we've put in the extra restrictions for tonight. We want to make it clear that we need, in this global pandemic where things are getting worse all around us, we need to pay attention to that. We need to keep doing what we're doing because we're on the right trajectory. We don't want to blow it now.
Follow-up, Craig?
Yes, thanks. I was just wondering, is there a maximum threshold for which contact tracing can operate in BC? And if we reach that point, would you call off contact tracing, or would you have a continuing on for information purposes? Because the reason I'm asking is a representative from Toronto Public Health was saying on the news that because contact tracing was called off, they didn't know where outbreaks or clusters were happening. So I was just curious what BC's approach would be.
Well, we recognize that this virus is one that is amenable to those types of public health actions like contact tracing, and that it is a key part of how we can control or at least understand where the virus is spreading, and that helps us take the measures that we need to take to control it. So very early on, we put resources into contact tracing, and as Minister Dix reported, we've hired thousands of people to support our contact tracing. We started that in the summer when our rates were very, very low, and that has helped us. We have come up against the edge of us being able to do that effectively, particularly in Fraser Health a couple of weeks ago and in the north. And we are rearranging and supporting as a system in our public health system how we can support those areas when we have surges in different parts of the province. And the BC CDC has set up a contact tracing node that we can support, but there are limits to what we can do. So we are focusing, particularly in the north and in Fraser Health, we focused on key high-risk environments. We've put together the school team that I talked about, as well as a workplace health team, because as we're seeing across the country, and we see here periodically as well, we do get quite large outbreaks in different workplaces, whether it's poultry processing, whether it's Canada Post or Amazon sorting centers, or whether it's related to the ski resorts. So we have been focusing on trying to identify those types of situations where it can spread widely to larger numbers of people, both in workplaces, in school settings, in healthcare, of course. And part of why we put in the restrictions on events that we have is because we were seeing so many clusters and cases related to private gatherings and social social gatherings. So those social gatherings were what tipped us over the edge a few weeks ago, months ago now, I guess. So those are the things that we're looking at. So for us, we have put a lot of effort and time and resources into maintaining our contact tracing, and we have not yet been overwhelmed, but we have been on the edge a few times and are taking measures to make sure that we can support each other around the province. And we all need to do our bit because we don't want to be in that position, because that makes it so much more challenging to curb transmission.
Just one or two additional things about where we stand. As I say, 1,297 people have been hired. A further 76 positions have been made available and will be hired by the First Nations health authorities. We received support from 70 FTEs from Statistics Canada in terms of our contact tracing. We also have 362 people at the interview stage and 123 candidates. In addition to that, at the offer stage, what we're looking at right now, because there are a significant number of candidates in the pipeline, is whether those new positions will be accessed for continued contact tracing work or if there are other opportunities. And of course, we want to also be in a position to address attrition. But 11,189 people across BC express interest either directly to health authorities or to Health Match BC in being involved in contact tracing. And just to put this in context further, in Fraser Health, they've hired 603 contact tracers to date. There's a further 111 in the interview stage. And we've deployed 28 additional contractor tracers redeployed to Fraser Health from the PHSA, from their rapid response pool. So we continue to be, from all perspectives, very interested and very engaged in the strategy in BC, and other provinces have had different circumstances and different views on this, but we're very committed to this idea, and we're going to continue to provide resources in support of it.
Thank you. The next question comes from Lisa Cordasco, CHLY.
Thank you. Good afternoon, Dr. Henry. I'm wondering if you can give us an update on where you're at with genome sequencing of the COVID virus that was found in BC mink, and what are the next steps in terms of public health?
Yeah, so we have been doing whole genome sequencing, as you know, on random samples and some select samples, mostly to help us identify new strains and also help us with managing outbreaks. So it helps us understand if there's been more than one introduction into a school or into a care home, and it helps us figure out how transmission is going between people. So I still do not have any new updates on any of the approximately 20 or so recent isolates that we have been sequencing of people who have traveled recently from international traveling, particularly from the UK. So we still have only the single confirmed variant, but I know there are, as I say, a couple dozen that are in the pipeline. It does take some time to do the whole genome sequencing, so we will, of course, let people know as soon as we get those updates, but I'm afraid I don't have any new information today.
Actually, I'm talking about the mink, the animals on the farm that were going to do genome sequencing because of the issues raised by the mink, in Denmark, and the passing of the virus between humans and animals. Do you have any information on that?
I do, and I apologize for that. Yes, so we did do whole genome sequencing of, we had sick farm workers as well as mink on one farm, and they did have the same sequences, which tells us that the mink probably got the virus from the humans. And there were a few variants, but none of the genomic variants that we were concerned about that they had seen in Denmark, for example. So there has also been identified mink that had died from another mink farm. So when we detected the first case, the chief veterinarian and the Ministry of Agriculture was involved, as was CFIA and WorkSafe and our public health inspectors, and we did inspection on all of the mink farms in British Columbia. There was some mink in one additional farm that were ill and tested what we call non-negative at the Animal Health Center here in Abbotsford in British Columbia, and those samples have been sent to the CFIA lab in Winnipeg as well. But we expect they will be positive. There were no humans identified who were positive on that farm, so we're not entirely sure. The investigation is continuing into how the mink were infected. So we continue to monitor all of the mink farm here in British Columbia. The outbreak at the one farm is in the phase where we have not had new cases for a period of time, but it's not yet been declared over.
Thank you, and we have time for one more question this afternoon. For everyone listening today, Dr. Henry and Minister Dix will release a statement with the latest information on cases, hospitalizations and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bca.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. And the last question this afternoon comes from Andrea Ross, CBC.
Hi there, this question is for Minister Dix. A restaurateur we spoke with today ordered thousands of dollars worth of perishable food for tonight, and given the reservation cancellations he's seeing now, he's going to try to open his restaurants tomorrow just to try to sell all that food. Will your government compensate restaurants for the revenue they will lose tonight as a result of the last-minute public health order around liquor sales? And if you can also provide this answer in French, that'd be great.
I will say again that I encourage people to be flexible with their reservations, and absolutely, if they don't feel they can enjoy a meal with late at night without alcohol, then tomorrow would be a great option, and I hope they can support it.
Thank you very much. As you know, there is a restriction with respect to new restriction with respect to last call. Essentially, people have to order and receive alcohol by 8 p.m. So it's not our expectation that we'll be directly compensating, no. But I would say this, that I think that the order, given what we know, is a necessary step to control the transmission of COVID-19. As Dr. Henry has said many times, it's for now, it's not forever. These are some important steps that we have to take. We've seen in the last week, we've seen across Canada, we've seen around the world the impact of COVID-19 in this period. We know, and our strength and our belief in the restaurant sector has been demonstrated many times. And Dr. Henry has led this, I believe, that people can go to restaurants safely. And I think we've demonstrated that to a great extent in BC. We're the only place west of the Atlantic provinces, anyway, where there is in-restaurant dining at present. So we're going to continue to work at that and work with the industry. I think the industry on balance has done an excellent job, and we're going to continue to work with them to try. I think what they do is important and essential, which is serving food to people is an important thing to do, and we encourage people today to get takeout and over the next number of days and to shop local and to eat local where possible. So just one more thing that I didn't mention, because I think this question has been raised and was raised, is that tomorrow there will be immunization clinics in every health authority but one, the Vancouver Island Health Authority, which has used up all of its Pfizer allocation that it presently has. So they obviously won't be having a clinic, although there will be some of the effort that's being led by the First Nations Health Authority, including in Vancouver Island, will happen over this weekend there. The other health authorities will be holding immunization clinics on January 1st. En français, je dirais que
好，那么卫生厅长用法语再说了，那我给大家再重复一下，过去24小时里边新增的呢是683例，目前为止51983例 BC 省。那么 其中125例是在这个新增125例是在沿岸，飞沙卫生局是447例，岛上卫生局是11例新增，内陆卫生局是64例，北部卫生局是新增了36例。这个绝对数字来讲，好像北部比较少，但是北部的人很少，所以从比例上来讲，北部卫生局情况和飞沙卫生局的情况是一样的严重。这也导致了刚才博宇医生说了，就是他们重点的关注的就是飞沙卫生局和北部卫生局，就是这个情况。那么到目前为止呢，住院的是374个，其中76个在重症监护。这个呢比礼拜二给大家汇报80例少了4例。那么总体的住院上次是373，那么现在374。
Thank you, and this is all the time that we have today.
那么2020年整体的死于与新冠有关的死亡的是901例。那么刚才卫生厅长最后也是说祝大家新年快乐。那么也是这句话也是我代表我们这个港湾 TV， 也祝大家所有的网友以及你们的家人有一个更加光明美好的2021年，我们明年见。